push to expand Medicaid in the state will try again. It's the fourth legislative effort to find coverage for more than 77,000 Nebraskans left without health insurance. While both sides say it's needed, they disagree on how to pay for it. Reporter Nick Starling explains.
Medicaid expansion is one of the many big topics ready for debate on the legislative floor this session.
Nebraska is going to be at a disadvantage if we choose not to embrace the expanded Medicaid.
Omaha Senator John McAllister is introducing a transitional health insurance program, the fourth try to expand Medicaid in the state to provide health coverage to more Nebraskans.
It embraces free market principles and uses private insurance.
The difference with his proposal is a private market alternative to Medicaid expansion, which Senator McAllister says will help more than 77,000 Nebraskans falling in a coverage gap.
They're the people that work at fast food restaurants, farming occupations, personal services. So those folks will have insurance, health insurance, just like most of us have.
It's extremely expensive.
However, the Platt Institute says the state simply cannot afford to have this type of expansion and says the plan doesn't cover intended recipients in the coverage gap.
So what they're doing is coming onto the state's program at the cost of the state, at the cost of the taxpayers, and they're getting a pretty generous insurance program in the private market, and it's breaking the banks of states.
The Institute also says this expansion would be a disincentive for people trying to find better paying jobs.
They want this insurance, and so if they're making too much money at their job, they'll quit their job. They get stuck in the cycle then at the expense of taxpayers.
But McAllister says the state will only pay for 10% of the coverage, and the federal government pays the other 90%. If that doesn't happen, this bill falls flat.
We aren't burdened by a program that's no longer funded at full levels.
Reporting in Omaha, Nick Starling, KMTV Action 3 News.